Oh my God. Oh my God. You didn't have to do anything. Oh. Oh my God. Oh my God. That felt amazing.
You said a few weeks ago you were in a lot of pain, right?
So at the beginning of January, I had for 2 weeks my left side, and it started, I forgot the word you used, but up here.
Yeah, the occiput.
The occiput. And then it came down all the way to my trap, to my shoulder. And then after 2 weeks, that passed. And then I think literally the next day, the left side got aggravated. And the same thing from the occiput and all the way down. I think I changed so many things. Like I'm trying to like look at my posture a little bit better. Trying to just work out a little bit more.
Now how about leaning your neck all the way back?
Tight. So you feel, if I lean, you feel like a pull here.
You're getting more on the left today.
Yeah.
Now tilt your head this way. Good, and then tilt back.
You hear a crack already.
Yeah, so leave a couple of cracks for us.
Yeah.
And then tilt this way.
So now it's extremely tight.
So
on this
she's
side.
getting more on the left, so we gotta make note of that. Okay.
But 2 weeks, remember in January, it was
the
like
right,
this on
right.
the side.
So we just moved over. So we might find more of the acute or the immediate stuff on the left. Okay, so I'm gonna bring this table up.
Okay.
You're gonna put your hands here. We're gonna give you a good stretch at the same time.
Okay.
And just have this stretching or traction run in the background.
Okay.
So I can feel a lot of tension through the mid-back right away.
So where you're pressing now, it already hurts, like the trap.
Yeah, this hurts,
yeah.
right?
Yep, all over there.
I'm sorry.
No, it's fine.
Is it okay if I work into it a little bit?
Absolutely, please.
Okay. All right, thank you.
Lord knows I need it.
Yeah, it's good to get it worked on. So right in there, super tight.
Yep, absolutely.
Yeah.
Oh my God.
Right in there. Right in there. And I'm working up these thoracic area here.
When you put the pressure there, it takes it off of the, like my upper neck.
It helps a little bit? Okay, good. We're just getting started. There's a lot to do for you.
Oh my God. When I tell you that hurts so much.
Oh. But that's the spot, right? I'm on it.
That's it. Yep.
Now turn your head back to center.
Oh.
Good. And now turn it all the way to this side, okay? And you have tight muscles everywhere today.
I listen.
That doesn't surprise you that I said that?
No. You know why? Because I feel it.
Yeah.
And my body is. Do you know when your body tells you like something is wrong?
Yes.
Not something is wrong, but I feel it.
But it tells you like it's stressed out.
It's telling the amount of stress. Like I'm trying to stretch more. It's just when I tell you, the amount of stress is I think is just affecting my body.
Yeah. And I'm just gonna start looking at the neck a little bit.
Sure.
Like right in there. Do you feel that muscle?
Yep. That's where it hurts. So even if I'm just sitting down, I have to hold this part and I have to put pressure on it just to alleviate the pain. Yeah.
Like you reach up and stick your thumb in there?
Yep, that's it. Or I have a golf ball and I carry it in my bag. No joke. I can show you guys.
And you just jam it into the side of your head?
I like put it on the wall and I like put it on my put it on my back.
Go get the golf ball.
Do you want me to get it? I'll go get it.
Go get the golf ball.
The golf ball? Yeah.
You have a golf ball. You have a golf ball. This is
and then I
golf ball. All right, and then what do you do? Let's
So
say
I'll put it on
this
the
is.
wall.
We should take note of this.
and I'll put it in like the spot that's hurting me and I'll just leave it there and I'll put pressure on it.
And what do people at work say? Do they think you're crazy?
I don't know.
All right, we're gonna use the golf ball. Okay. All right, so turn your head this way. Do you feel that?
Yeah, no, I feel it. I can't.
All right. So we're gonna do the golf ball technique.
Oh. You hear it cracking already.
Yeah, it's already popping.
When I say
you can
that,
do the TMJ with the golf ball.
guys, don't hate on my golf ball, all right?
You can rub the golf ball in here. But yeah, here's what we're gonna do down here. This is the SCM muscle right in there. We're gonna roll down the SCM. All right. You feel that, right?
Yeah, no, I feel it.
It's leaving little golf ball marks on you.
I haven't been able to crack my neck in a month.
Okay. Can almost guarantee I'll be able to get it to crack.
Know.
We're not going to use the golf ball here.
Okay, that's fine.
Show that the golf ball's not in my hand. Okay, so big breath in and blow it out.
Oh my God. I think my body has been craving that.
All right, good. Right there. Lie on your back next. All right. Are you ready?
I am ready. Well, I mean, are you ever ready for this?
Probably not. So first let me pull a little slack out of the table, okay? Big breath in and blow it out.
Oh, wow. You felt it. You felt it like all along the spine and what is it? It's the vertebrae, right?
Yeah.
The decompresses? Oh my God, you felt it. All little cracks.
How far down did you feel it?
To the bottom of my neck.
Okay.
Absolutely, from the top to the bottom.
All right.
Oh, that felt really good.
Good. There's more.
Phenomenal.
Here, let me have that golf ball. Watch. This is a golf ball adjustment. Drop.
Oh my.
Did you hear
I
that?
don't think I was ready for that. I totally wasn't ready for that. Oh my God.
You heard it, right?
I did. I heard it.
All right. There's one more. And I think there's a lower one here. All right. I think that's enough there for now.
What does that do? I didn't even know that was possible. To crack your ear.
Look, you just got some ear stuff on you.
Oh my God. Oh, that felt good. That felt really, really, really good.
All right, good. So now your neck's opening. Let me just see here. Did you hear that?
Yeah. What was that?
Just cracked your skin in the forehead. Let's do this first.
Oh.
There you go.
Oh my God. You have to be kidding me. Do you not hear how loud my toes are?
Those look good. Lie face down. May I move this down
Sure.
a little bit? Okay.
Oh my God.
Ooh, that was the big
Oh
pop.
my God. Oh, you have no idea how I've been dying for that to crack. Oh, that felt so good.
All right, see? Should have come in sooner than a year.
Oh my
Let me see if there's one left. There's one. Ooh, there's another one. There's another. All right. So this hand goes up here.
My shoulder's
This
all
hand
messed
goes
up
right on
too.
your belly button. And I'm going to leave your fingertips up here. Reach under.
Oh! I don't know if I want to laugh or cry. Oh my God, that felt insane. What was the word I always use at the comments? Amazing? I think it was.
Absolutely.
Absolutely. Oh my God, that was amazing. Oh my God, do it on the side now. It was so good.
You do say absolutely a lot.
I do say absolutely a lot.
So people in the comments would leave like absolutely.
Next time I'll come up with a different word, I promise.
No, that's your word. It's a good word.
Oh my god, that was multiple cracks. Ah, I feel amazing. Feels so good. Absolutely amazing.
Good.
You have no idea.
All right, so here we go.
Oh, oh, God. That felt beautiful. When I tell you beautiful, like I feel when my body is just sitting down, like I feel it just my spine is just getting smaller and smaller and smaller. And I feel now that everything is just like I'm able to breathe, you know?
Good.
Like my spine feels long. I don't feel tight. I feel relaxed. I feel really good.
Oh, that's so good. There's more. Let's do another one here.
Yep.
Good.
Oh my God.
And squeeze your knees together. Good. Do you hear a
Yeah,
crack?
I heard it.
Point to where you heard a crack.
Right here. You heard it. Already in position for you.
Thank you.
Oh my God. You didn't have to do anything.
It was already cracking.
It was already cracking. That's insane.
Let's do one more though, okay?
Oh. So good. Oh my God. Oh my God. That felt amazing. Absolutely amazing. I mean, there are multiple cracks everywhere in my body.
Yeah, that was so good.
So what's this, like, how often should you come?
You should come every day for the rest of your life.
Do you think I should come every day or like once a month? Which one?
Well, more than once a year.
I know, it's
here?
bad.
So how about between a year and every day, there's a sweet spot.
All right, but they need to keep track to make sure that I come, okay?
All right, but seriously, I think in your case, once a month would be really good.
It's so bad, right?
Yeah, because you really
I
have
need it.
a lot of stuff.
Yeah.
Now, so lean back and then go forward and make sure you feel okay.
Oh, I feel perfect.
Good.
Perfect.
Good.
Perfect. You just overhauled me.
Oh, okay.
You got my hair messed up
All
and
right.
everything.
Absolutely. Absolutely. Do you feel good?
I feel amazing.
What was your favorite part?
Everything.
All right.
Honestly,
Good.
everything.
Try your neck. How's your neck feel now?
Amazing.
Good. All right.
Just there's so much relief because my whole body needed it.
Yeah.
Where it's just everything was just so effective.
Good.
So effective. So thank you.
Good. You need
Appreciate
that.
it. Thank
All right,
you.
Thanks. Bye bye.